The midface is really technically the area of the upper face that sits on the maxilla. It is it contains skin, subcutaneous tissue, the smas, the muscles, and then the bone. It is the area underneath the orbital rim, extending downward towards the lip in a triangle. This area can be manipulated in many different ways, either through skin incisions or through incisions through the mouth and through the lower eyelid. Probably the most direct and the most able to lift that midface vertically is through the lower eyelid, and involves usually a subciliary incision. It is the dissection through the orbital retaining ligaments into the midface that allows surgeons access to the structures of the midface and allows one to be able to lift the midface upwards. And generally, there is some form of fixation of the midface around the orbital rim and the orbital structures. The idea is that by releasing the orbital retaining ligament, that at the same time the fat within the orbit can be released, and sometimes it may need to be repositioned. And when the midface is elevated, that the whole of the junction between the midface and the orbital rim will change, with the idea being that the distance from the lower eyelid to the orbital rim will be shortened in a perceptual manner. This is best probably seen in this example where in the upper picture the man and in the lower picture the lady, both the distances from the lower lid to the cheek have been altered. In the gentleman, there is a lot more hollowing, there are a lot more age changes, and the midface is dropped further. He has a lot more aging changes. The lady has got some excess fat of her lower eyelid and some minor midface descent. Both patients have had a midface lift in combination with an upper and lower blepharoplasty. And in these patients, we can clearly see the shortening of the distance between that lower lid and the midface. We can see in the lady, this is at 6 weeks, she's still got the scar of the lower lid blepharoplasty, and this will take some time to settle. A mid-face lift can also be performed at the same time as a facelift and a neck lift. And in this lady, she has a lot of age changes related to sun damage, smoking in the past, and she wished to rejuvenate her periorbital region and also rejuvenate her lower face and neck. We can see in particularly the tear trough and how it descends along the inside of the nose, across the orbital rim, and it's almost created a line. And in this area that I have with the arrow, we can see the malar area, which is a very difficult area to address. This is mainly resulted due to age and changes with time and mid-face descent, but it's a very difficult area to alter. Perhaps, other than building up the tissue with a facelift, standard facelift, or placing fat to build up this area, one of the best ways is to try and elevate the mid-face through a lower blepharoplasty incision, which this lady has had performed. We can see her pictures at a week. We can see the amount of bruising and swelling around these areas. And in her long-term pictures, we can see in particular the alteration of that tear trough, the alteration of the facial grooving as it passes into the midface, and an elevation of the midface to decrease the length of the distance between the lower lid and that orbital rim, and that's really from just elevating her midfacial structures, which again are the SMAS and the muscular poneurotic layer, and again that is performed by release of the orbital retaining ligament and elevation of the structures of the midface. There are other ways to elevate the midface through temporal incisions in combination with incisions through the oral mucosa, although this is now less frequently performed than in the past. We can also access the midface through a transconjunctival lower lid incision, but usually patients that have age-related changes also have skin excess, and a lower lid subciliary incision is often preferable to be able to access the midface where there is skin excess required.